statistics about that person, Stephen J. Roberts. He has told about. So my discussion will be the base will be on that line only regarding the infertility. The topic were almost similar. So many of the things already Dr. Kumarsan has discussed in detail. But I shall also try to go on a clinical point of view, whatever the matters is there. So that we know that India is the largest producer of the milk at present, and it is producing 196.18 million tons as per the 2019. But the people, the farmers, they are facing the major problems or major frustration is about the infertility. Now, as Kumarsan sir has already elaborately spoken about the infertility problems, I will only go very superficially about that book, and I shall discuss the clinical point of view of this infertility. So infertility, as we know, that it is the reduced degree of fertility exceeding in days after the ideally assigned period for fertility coming period. The ideal fertility for cow, it is a calf within 12 to 13 months for the cow, and for a buffalo, it is a calf within 13 to 14 months. That means, in the last also that Kumarsan sir has, and he has already told that this is for this reason only. Somebody was telling, then what is the procedure to reduce the intercalving period. So this is what the intercalving period. There are so many factors that depends on the intercalving period. That there are so many factors Dr. Kumarsan sir has already discussed, but we have to have this in tradition. We have to have this fertility, that calf per year. Then only our production and reproduction will be maintained. Otherwise, we will have a widened intercalving period. Then there will be loss of economic loss, like that is loss in terms of the live calf per year, reduced lifetime milk production, extra feeding to the cows, whatever it is going on in waste to manage those cows, then wasteful expenditure on the infertility treatment. So whenever the infertility problems come, we used to treat the cows. Those cows, sometimes it may not respond to those treatment, and ultimately there will be waste of expenditure on the infertility when we are going for treatment. Then there will be cost of labor for whatever the expenditure we are making for manage the herd. There will be extra labor cost. Space will be there, unproductive animal space. It is taking the unproductive, that is, space is also there. Like that, we have that what are now the causes of infertility? As we know that what are the causes of infertility? So what may reduce the fertilizing ability of those cows? So that we want to discuss this one. If we see that anatomical defects of the genitalia causing infertility, that is also one of the fertility in our dairy cows. Under this one, there is congenital anomalies, which is very, very less. But the acquired causes, which are maximum contributing to the infertility problems in the dairy cows. So, congenital anomalies, we know that congenital anomalies, those are ovarian agenesis, ovarian hypoplasia, abnormalities of the uterine tubes, intersexuality, and freemartinism. Sometimes there is segmental aplasia of the Mullerian ducts, which sometimes there will be some parovarian cyst. There may be atresia of the vulva. So these are some congenital anomalies which may involve or which may affect the cow which is used for dairy purposes. Then the acquired causes, there it is very maximum because the congenital problems we can, whenever dairy cow is there, we can just isolate those cows and we can just cull them with a careful observation. But the acquired causes, it has acquired, the cow will acquire these problems during the lifetime or during the process of the that it is reproductive life. So these acquired abnormalities, these are maximum, which may be due to, that is, lesions in the uterine tube and the surrounding tissues. There may be adhesions of the uterus sometimes. There may be parturient trauma of the tubular genitalia. There may be rupture of the perineum. There may be parturient laceration causing cervicitis, severe cervicitis. There may be cirrhosis of the cervix. There may be some other tumor-like structures in the genital organs. So this will include, and this will contribute to the infertility of the dairy cows. These are acquired during the process of reproduction. The number two is, that is, functional disturbances causing infertility. That is also very important. That is the most important of the functional causes of infertility. Functional, that is, disturbances which cause infertility. It will include that functional. The animal is functional, but there are some problems because of which the animal is okay, but there are some problems because of which there is infertility problem. So it, number one, under this condition, it is the unobserved estrus. The animals, they are coming into stress, but because of the ignorance of the heat symptoms, or because of our busyness, or because of our negligence to the animal, the stress may be unobserved because we have not observed the animal properly. Then the animal may suffer from true anestrus. That is, I will discuss this one in detail, that true anestrus. There may be suboestrus or silent stress. The animal may undergo suboestrus or silent stress, which is not visible. Actually, the animal will come into stress. The physiological changes will be there. There will be development of the follicle. There may be even the ovulation of the follicle. But due to low level of threshold limit, the low level of estrogen, the animal may show very less, or it may not show even stress signs. So that is called the silent stress. The animal is coming into stress silently. Then sometimes there may be delayed ovulation. That will also cause infertility because of delayed ovulation. Our timing of AI may not be proper, and there may be aging of the spermatozoa, which may lead to infertility. Anovulation is another problem. The anovulation, that means the animal is coming into heat, the animal is showing signs of it, but actually there is no ovulation. So that I will discuss in the subsequent slide, that is delayed ovulation and anovulation, how to diagnose these cases and this. And the most important is the cystic ovaries. Now, as in the previous lecture, it is said that there are nutritional imbalances are there. So because of nutritional imbalances, maximum dairy cows, especially those high yielders, they used to suffer from cystic ovarian degeneration. So this is what the functional disturbances that cause infertility in the dairy animal. Then number three is the managemental factors that is responsible for infertility. That managemental factors, it depends on the manager or the farm owner, which we have that the care should be taken to the farm. So this includes that providing proper nutrition. If we are not providing proper nutrition, that means it may cause infertility. Then there is effect on the time of puberty. Because of less nutrition, there may be delayed puberty. Effect on the heifer from puberty to first calving, there may be also some of the things that because of low feeding, because of some other low feeding, that the heifer has shown the puberty, it has attained the puberty, but from puberty to first calving, the timing, it is maximum timing is taking. Then that we have to take care of those things, that energy requirements and body weight changes in the pregnant and lactation animal. So that is also very important. Dr. Kumaresan sir, he has already discussed these things in detail. Protein, we have to provide the protein requirement to the animal at appropriate at appropriate ratio. Minerals and vitamins we should add. Then metabolic profiles, it should be very much concerned about the health of the animal. Then for managerial efficiency, that whenever it is poor estrus detection will lead to infertility. So estrus detection, it should be very much proper, because in the previous speaker also he has told that our timing of the insemination, it should be proper. For proper timing of insemination, we have to go for proper detection of the heat. Then only we can go for proper timing of the insemination or proper time to breed the animal. Then incorrect method of, sometimes there may be some problem with the artificial insemination. So that also will be taken care of. And these are the managerial practices which if we go for good managerial practices, this can be avoided and we can lessen the incidence of the infertility in the herd or in the animal. Number 4, that is infection of the genitalia causing infertility. Under this, that infectious causes, there are two, that is non-specific infection and specific infection. Non-specific infection, it may lead to purpureal metritis, endometritis, pyometra, salpingitis, cervicitis, and vaginitis. So these are the certain conditions which may be due to non-specific infection. But there are certain specific infection, that is which will lead to some certain amount, and it can be diagnosed with some symptoms even. So that is the vibriosis, sometimes brucellosis is there, which will lead to abortion and infertility. Then trichomoniasis is there, another problem. Leptospirosis is there. So some other viral agents like that is bovine viral diarrhea, this may cause infertility in the animal. So this infectious cause, we have to take care of those infectious cause, not to spread the disease in the herd from one animal to another animal if it is setting in on the farm. So this way we have to go for the causes of the infertility, that these are the causes of infertility. And now this, whatever I have discussed above, all the causes that will be leading to infertility manifested in the animals, mainly two clinical forms, that is anestrus and repeat bleeding. So whatever it is there, either if infection is there or there is certain conditions are there, or whatever the conditions are there, ultimately the animal will suffer from anestrus or repeat bleeding. We will discuss the repeat anestrus in detail. What is the cause of anestrus, what are the treatment, and how to get remedial measures for this anestrus. Now anestrus is a state complete where the animal will be complete sexual the animal will show complete sexual inactivity with no manifestation of stress. It can be observed after parturition as postpartum or pre-service anestrus, or following service as post-service anestrus when conception does not occur. Pre-service, post-service, and anestrus. This is the most often a sign of temporary or permanent depression of ovarian activity. Suckling is one of the main factors influencing the length of the postpartum anestrus period. The suckling, it is one of the major problem which cause postpartum anestrus. This, if suckling is continuously practiced during lactation, it blocks the ovulation and elongates period of postpartum anestrus and contributes to a lesser reproductive efficiency. So this is what it is, suckling, that may cause certain problem in the hypothalamus, because of which there is anestrus and it will lead to infertility. Certain pathological conditions of the ovaries or the uterus also suppress the estrus. So then pathological condition, we discuss those some pathological conditions that the anestrus and which the treatment also I will discuss side by side. The treatment also I will discuss because certain pathological condition of the ovaries and the uterus I will discuss side by side. Then the anestrus is the most common single cause of infertility in cattle. That is obvious. That is in case of cattle because of low plane of nutrition. This is maximum happening. That anestrus is maximum happening because of low plane of nutrition. Because we are not providing, the animal has been upgraded, the animal in the village condition in the rural areas, the animal, whatever the animals are there, they have been crossbred, maybe Holstein Friesian cross, maybe Jersey cross, but the feeding remains the same. Whatever the feeding it is given to our local non-prescribed animal, the same feeding style is going on. So that's why they are lacking in nutrition, and because of that only, the poor nutrition, the animal is suffering from anestrus. Now, if they under the anestrus, there is one condition that is the functional anestrus. It is from the Roberts book that in the very beginning, I told that as per the Roberts book, I will discuss some of the things so that it is obviously it is known to everybody and they can refresh whatever the from the field or the students they are seeing it or they are just listening to it, they can refresh their knowledge and they can refresh the uh, whatever the information is there. So in this condition, that cow is having normal functional corpus luteum present in one of the ovaries. So that is what the present of the that is one of the ovary. Under this, number one condition is the anestrus due to pregnancy. So we have to, in certain conditions, we have to take the incidence that the animal may be pregnant. So whenever we are going for rectal palpation to of genitalia to diagnose a case of anestrus, then we always keep it in our mind that the animal is pregnant. And if the animal, we do not see any signs of pregnancy, we do not see any signs of, then only we should go for other purposes. So that's why a pregnant, anestrus animal, whenever we are going for rectal palpation, we have to keep it in mind that it is, we have to check the animal as the animal is pregnant. But if we do not get and the genital organs, then only we can say, yeah, it is not pregnant. Now, this and that pregnancy in most of the cases for prolonged anestrum is pregnancy. Some pregnant cow may exhibit up to first trimester of pregnancy. They may sometimes they may exhibit the estrus, which is known as the gestational estrus. So for that one also, whenever you are going for the insemination, if it is a gestational heat, we have to take the history, and according that, after taking the history, then only whether the animal has been previously inseminated or not, we have to take the history. If it is inseminated, then we must take care that it may be pregnant, and if it is not pregnant, then only we should go for insemination. So this is what the anestrus that is due to pregnancy, avoid the animal for any kind of treatment, and we should advise the owner to go for that taking care of the pregnant animal, and the animal should be taken care of as a that pregnant animal. That is the number two is the anestrum due to retained persistent corpus luteum, and this is happening that uterine pathology, retained corpus luteum associated with gross uterine pathology. That already that I have already told in the previous on slide that there are certain conditions where the uterine pathology is there, and whenever there is a uterine pathology is there is always a corpus luteum in the ovary. So for this one, we have to go for the diagnosis of the condition, whether these conditions will include that, pathological gross uterine pathology that will include the pre-service or post-service biometra. Then it may include the maceration, it may be a mummification, it may be a mucometra, it may be a uterine unicornis case also. Sometimes there may be retained corpus luteum associated with early embryonic or fetal death. So this conditions. Whenever we have to identify whether it is suffering from pyometra, whether it is suffering from mycometra, that is whether it is suffering from maceration or mummification. We have to diagnose it, and corpus luteum, why the corpus luteum is there, and accordingly we should go for the treatment. Then number three is that anestrus due to suboestrus, weak stress, or silent stress. Sometimes what happen that the animal is coming into stress, but it is subnormal. The signs of the stress is very feeble. We cannot detect the stress, and the exhibited, that is the signs and symptoms of the stress is minimal. During the animal is said as the silent, that is the animal is suffering from substress or silent stress. This may be due to higher threshold level of stress to produce signs of stress. The that higher threshold limit of the hypothalamus to the estrogen. Estrogen is responsible for exhibition of stress. To be that sometimes the low by position is much then instantly as
Oh, oh. Hello? Hello, sir. Sorry for interrupting, sir. Hello, sir. Hello, sir. Sorry for interruption. Please check into your internet connectivity, sir. Your voice is breaking. Hello, sir. Hello, sir. Sorry for interruption. Sir, please check into your internet connectivity. Your voice is breaking, sir. Hello, sir. Hello, sir. Can you hear me? Hello, sir.
The use of heat expectancy chart may be followed. Frequent rectal palpation of the animal, use of vasectomized wool for heat detection, removal of CL, except in the condition where the animal is pregnant. The CL may be removed by manual rupture, or we may go for luteolytic hormones, for example, PG of 12. If it is a natural PG of 12, 25 to 30 milligram will be sufficient. And if it is a synthetic one, then accordingly we should go for up to 500 micromolarity we can go. Then for the anestrus, where there is a missed here. Now the main issue is the true anestrus. Condition: a cow having a small inactive ovary with no functional CL palpable per rectum. So under this, that the condition may be due to debility or the marked loss in weight, which that is the nutrition. It will lead to nutrition. So this is we are talking about the nutrition. Dr. Kumarasan sir are nutrition. If nutrition is okay, then we are not worried. Similarly, if we go for low plane of nutrient of carbohydrates, protein, minerals, and vitamin, it may lead to infertility and it may lead to that anestrus. During early lactation, cows are in a state of negative energy balance and fat stores are first used for lactation, maintenance, and growth, with reproductive processes receiving the lowest priority. So just after parturition, normally the mother will be busy with the utilizing the energy and the fat stores for lactation and maintenance and growth of the that is of the animal, but will at they will get the priority at the last. Similarly, for optimum reproduction, a body condition score of 5 to 7, that is, if we consider 1 as emaciated one and 9 as obese, then in between that on 5 to 7, it should be there at cupping. It is necessary according to Lawman et al. 1976. If it is lower than 5, then the potential fertility will be lowered unless there is a high substance nutrients after cupping. That is very important to manage the nutrient levels. This nutritional deprivation lowers pulse frequency by initiating hypothalamic inactivity. That nutrition, whenever we are going for, it will reduce the or it will lowers the initiate that frequency of initiating hypothalamic activity, and there is a direct correlation between negative energy balance and a reduction in release of gonadotropin-releasing hormone, which will lead to anestrus. The substantial decrease in body weight and body condition score is correlated with loss of adipose tissue, which results in increased concentration of non-esterified fatty acids, NEFA, in the plasma of cows. And this is an indication of the negative energy balance. Whenever the plasma of the cows will have much more NEFA, of the negative energy balance. Now, this is what the negative energy balance, how it affects the reproduction of the cow, how it affects the overall production of the cow. That negative, that is energy balance that will impair the GnRH secretion. If we impaired LH production, inadequate follicular growth, estrogenic function, it will reduce. Then there will be poor estrus demonstration, inadequate LH stimulation, and everything that will lead to that in this that errors in heat detection, delayed ovulation, and ultimately it will lead to COD and extended calving interval, repeat bleeding, and low pregnancy rates. So this is what we do for negative energy balance. So this is the chart which will make you understand that how the negative energy balance affects the reproduction in case of cow. Now this is the score, that is the body score, body condition score. If we see that if corrugation visible 3 to 4 away from tip of the spine, that the score will be 2. This is what there will be score 2.25. And if palpable fat and on points of the pins are there, it is 2.5. So everything, if it is in between, after scoring everything, if it is in between 5 to 7 degree, If to 5 to 7 score is 5 to 7, then the condition of the animal is good. If it is beyond that, then the animal may be obese, or if it is lower than that, the animal may be emaciated or it is a debilitating condition. So accordingly, we can go for this management of the nutrition to the animal. Now, the proper nutrition is that the, what if the animal is suffering from through anestrus, what may be done? It is before we have to go for the proper nutrition. Then we have to go for mineral supplement, therapy. We can go for physiotherapy. Sometimes gentle massage of the reproductive tract organs on 3 to 4 hours interval. There may be sometimes there is it is called os cervix pain with 4 to 5% glucose solution once in 4 days, 4 to 3 occasions may be helpful for exhibition of stress or bringing induction of stress in that cow. Then the hormonal therapy, it is already Dr. Kumarshan sir already discussed about this thing. The hormonal therapy is that GnRH, we can go for GnRH treatment, 2.5 to 5 ml intramuscularly. If no hit, then 10 days, a second, on 10 days, a second dose of recommended is recommended. Then we can go for FSH injection, still-based steroid injection. So these are the hormonal treatment. Then we can go for some ovarian protocol for these anestrus cows, which may be exhibited. These are the certain that ovarian protocol, or that it may be helpful for induction of stress in those cows, which is having smooth ovary, which is having true anestrus condition. Then some herbal or Ayurvedic preparation may be used for this anestrus treatment, though results are not very encouraging, but they do not have any side effects, so it may be useful for the anestrus treatment. Prajana, Banjana, Sajani, Istocare, Istoplus, this can be, fertility tablets, it can be used for treatment of the anestrus treatment. Then the main cause is the preventive measures, how to prevent the condition, how to prevent the condition of anestrus in case of cows. Number one is the adequate nutrition, either to promote optimum growth or to prevent body weight loss. Number two is dung examination and proper deworming at regular interval. Farmers to be educated to keep individual records of age, date of last calving, extras, and AI services. So these things can be done to prevent the happening of the anestrus in case of those dairy animals. Then another condition, whenever there will be negative energy balance or body condition score will be different, then it may lead to cystic ovaries. So these are cystic ovaries. That is, it may be follicular cyst or it may be luteal cyst. And the etiology of the cystic condition is basic, is the LH from the anterior pituitary gland is really, it is improper release is there. So in seen in the, because of so many problems, maybe because of stress, maybe negative energy balance, that is the some other stresses, condition, disease, and other thing. So whatever the stress will be there into the animal, so that will lead to improper release of LH. So it may go for the that cystic ovarian degeneration condition. It is generally seen in dairy animals and most common in Holstein Friesian. Common in closely confined animals during winter months than during summer months. So this is because of the lack of exercise of the animal. Now, it is common in between second and fifth lactation, more common in high-yielding animals, feeding high protein ration and lack of exercise and sunlight also cause that cystic ovarian degeneration. Frequent milking also called cystic ovarian degeneration, hereditary. It may be hereditary. Animals that are getting exogenous estrogen also may cause that cystic ovarian degeneration. High level of FSH also sometimes called that cystic ovarian degeneration. Now, the signs and symptoms of the cystic ovary, it is that nymphomaniac. In case of that follicular cyst, the animal will be nymphomaniac because of high level of estrogen. And in case of luteal cyst, the animal may go for anestrus because of high level of the progesterone. So this will go in case of nymphomaniac, it is called bullars, and in case of anestrus, there will be some relaxation of the sacroiliac ligament, where the base of the tail will be a little bit elevated, like a hump, and this is called the sterility hump. Now, the prognosis of this COD is early the diagnosed and the treated, the better is the prognosis. In severe cystic degeneration of the endometrium and atrophy of the uterine wall in hydrometra or mucometra, the prognosis is poor. So, this treatment contains that repeated manual rupture of the cyst at 6 to 10 days interval until the normal cycle and CL develops. LH 1500 to 3000 IU, that is HEG 3000 IU, we can go for this. Sometimes in luteal cyst, we can go for PGF12 injection. So these things are already known to everybody, but still I am just refreshing the knowledge, those who have, those who are in the field condition, in the field, or those who are the students. Now, the another condition of the infertility problem is the repeat bleeding. Repeat bleeding is defined as the cow with, excuse me, regular cycles, which is of length of 70 to 25 days, and with 3 or more services without conception. So that was the definition by Gustafsson, 2002, and Huey Isher, et al. 1997. The classification of repeat bleeding in 1988, Lafi and Kancene, they have classified the classification into 3 parts. That is cow, bull. Number 1 part is the cow. Number 2 part is bull. Number 3 or 4 is the environment and management complex. Environment and management complex. So there are basically 3 factors, that is cow, bull, and environment complex. The cow factor, it will be the anatomical defects of the genitalia. Sometimes there may be segmental aplasia of the uterus, cervix, ovaro-bursal adhesions, which may prevent the union of the sperm and the ova in fertilization. In 2, that is congenital defect of the ova may also cause sometimes repeat bleeding. The uterine infection is another condition in case of cow. The cow factor, that is uterine infection, subclinical endometritis is commonly encountered in repeat bleeding cows. The incidence, which may varies from 14 to 52%, and it is a common cause of conception failure in repeat bleeder cows. The diagnosis of this condition, that endometritis, may be done with white side test. If we go for white side test, that is no color normal. If it is no color, it is normal. Light yellow mild, dark yellow severe. Kumar, it was reported by Kumar 2015. Color change might be due to neutrophil infiltration and metrorrhagia, estrogenic dominance, that is Raja et al. He has described this thing. Now the white side test, you know that we have to collect the cervicovaginal mucus, an equal amount of cervicovaginal mucus along with equal amount of the reagent, that is 5% sodium hydroxide, in a test tube. We mix it, then we have to boil it, let it cool. If after cooling, if there is development of the color, then it will indicate that no color, there is no endometritis. Light yellow, there may be a mild endometritis. Yellow, moderate endometritis, and dark yellow, it is severe endometritis. So in this condition, that wherever it is a mild type of endometritis, we may go for sexual rest. If it is a little bit moderate type, we may go for certain treatment. And if it is a severe case, we may go for some other treatment that I will discuss in subsequent slides. Then another condition in that endometritis, the diagnosis of endometritis, that is physicochemical properties of cervical mucus that may be changed. Physicochemical properties, the pH may remain 7.8 compared to normal 7.2. Then endometrial cytological examination by cytobrush technique and mucus smear, that can be very much helpful for this mild type of endometritis or hot ovary endometritis, that is just after parturition, if any infection is there in the uterus, with this endometrial cytological examination, we can we can diagnose it, and we can accordingly we can treat the anemia. So this is what the endometrial cyto, that is uterine brush. You know that is a long brush. It is like that. Then if insert the, that is cytobrush into the uterus, uterine horns, rotate it, then bring it out, and along with the content of those in the brush, you make a slide, stain it, and that is you see it under microscope. If there is polymorphonuclear cells to epithelial cell is more than 12%, that means PMNS. It is, if it is more to epithelial cell, then you can say that there is infection. Indicates significant subclinical endometritis. That is that was reported by Matthias et al. And Leblanc et al. In 2002. Then for diagnosis, we can go for the anti-sperm antibody is also detectable in cervical mucus, which interferes sperm penetration in the cervical mucus, prevents membrane fluidity changes needed for capacitation, and reduce the ability to undergo acrosome reaction. So this is antibody, that anti-sperm antibody is also one important that can be detected. Then through ultrasonography, we can go for this diagnosis of the endometritis, mild type of endometritis. It will based on intrauterine fluid and on the evaluation of the uterine diameter. So that will be the diagnostic point of view. Then in certain conditions, that endocrine dysfunction and hormonal imbalances also lead to that repeat bleeding. Endocrine dysfunction and hormonal dysfunction, anovulation and delayed ovulation. Earlier, I told you that this is another reason for infertility. The cause of ovulatory disturbance is basically deficiency of LH, but it is predisposed by inadequate nutrition and stress. Endocrine dysfunction, that anovulation and delayed ovulation, anovulation and delayed ovulation, it can be diagnosed by repeated rectal palpation of the ovary, at least for 3 occasions. Then we can go for this diagnosis. On the day of estrus, if we go for palpation of the ovary, then after 10 days of that day 10 of the estrus cycle, if we go for the palpation of those ovaries, if we get a corpus luteum, there will be delayed ovulation. If we do not get a corpus luteum, it may be regarded as the anovulation. So that way we can diagnose the even anovulation and delayed ovulation. Then aging also that also cause repeat bleeding. In some old animal, the repeat bleeding is much more in comparison to the young animal. Then the cow factor, it is there, already discussed. Then now the bull factor. The bull factor, it contains the low quality semen. So semen, if our semen quality is low, maybe at the time of collection, maybe during the time of preservation, or during the time of thawing, at the time of insemination, if we do not maintain the proper standard of the thawing, at the time of insemination, the charging of the egg gun, or during the time of preservation, so this will lead to low quality semen. So that way, bull is also responsible for repeat bleeding. Then insufficient number of sperm. Per dose, the number of sperm, the motile number of sperm should be there. So if there is low motile sperm or the live sperm in the dose, then also it may lead to fertilization failure. Ultimately, it may lead to repeat bleeding. Then in certain conditions, there may be infertile bull. Apparently, it is seen that the bull is normal in semen production, motility, and other thing, everything is normal, but due to some other factors, due to some hidden factors, the semen is not able to fertilize. So those bull also known as that may contribute to infertility. Then sometimes what happens at the time of insemination, the aging of the spermatozoa may be there because of delayed ovulation, that is on factor, or sometimes the overall the spermatozoa in the process of preservation, that may be aged one. So due to some reason, the aging of the spermatozoa may take place. So this will lead to infertility, and ultimately there will be repeat bleeding. Now the environment managemental factor. The environment managemental factor, it will depend on the heart size, if the heart size is very big, the larger the heart is, greater is the incidence of the repeat bleeding, because it is very difficult on the part of the herdman to observe each and every cow more closely in a bigger herd. So that's why there will be miss in the interpretation of the whether the cow is in heat or not. So sometimes that may be one of the reason of the that that the repeat breeding, because we are not doing the insemination or the breeding in time. Then next is the housing system also contribute to the repeat breeding condition. The pregnancy rate is higher in loose housing compared to that in the stalls. This is some of the findings that Williams 1971 has done. This may be due to the fact that freedom of movement of the animals in the stalls increases intensity of signs of stress, making it easy for the herdmen to detect it. So thereby, whenever they will be outside the animal, then they may go for homosexual behavior. They may just go to much more physical activity. Then it will be easier to detect the animal in stress, and thereby we can compensate the time, or we can inseminate the animal at appropriate time. Then time of AI, whatever may be the length of the heat, the AI should be done at the mid or late hours of the heat. So this is what the condition is said, that that is one of the reason that we should go for insemination of the cow in the mid heat. So mid heat to late heat, it is very much good, but to go for insemination to mid and late heat, we have to go for efficient detection of heat. That means appropriate time of onset of heat. Then only it is possible to go for insemination at the mid heat or late heat. Next is hygiene at the time of AI and calving. That is one of the reason that hiding of the that is maintenance of hygiene at the time of AI and calving. Inadequate hygiene at the time of AI or calving may result in endometritis or retained placenta, or leads to repeat bleeding. That is another on reason why it is to be hygiene. That is hygienic should be maintained at the time of AI and the calving. Skill of heat detection, another condition where poor and inadequate heat detection programs greatly contributes to the increased incidence of repeat bleeding. So heat detection is must for timely insemination. This is what the says, that is in the that is mid heat. Whenever the animal is whenever the animal is mated or it is inseminated at the mid heat, the maximum percentage of conception rate is shown here. So that's why mid heat to late heat is very, very important. And for that one, we have to have the onset of estrus. Then only we have to have the time of onset of estrus. Then only we should go for, and we can go for the insemination of the cow in mid heat. Now, treatment of the repeat bleeding, it is the treatment of repeat bleeding. It varies from the animal to animal, because the cause, it varies with the cause. If the animal is suffering from endometritis, or that the cow is suffering from endometritis or the uterine infection, then we should go for some antibiotic. Genital infection may be treated by antibiotic like tetracycline, gentamicin, may be treated with glucose iodine solution even. Then intrauterine infusion of immunomodulators like E. coli, polysaccharides, oyster glycogen, infusion of serum, plasma or hyperimmune serum, or leukotriene can be used for the treatment of the uterine infection. Sorry. Then enzyme therapy can also be there. Enzyme therapy, enzyme like trypsin, chymotrypsin, lysozyme, and papain intrauterine has 59.7% cure rate. However, the conception rate is suboptimal. Endometritis may be cured with this one, but the conception rate may not be to that extent or to the expected one. Then sometimes we can use the antioxidants like vitamin C and E are also known to modulate the oxidative stress and reduce the endometrial damage, both biochemically and histologically. So these are the certain treatment for anestrus. Then anovulation is best treated by 1500 to 3000 IU of HCG intravenous at the time of AI. That is, and delayed ovulation needs no treatment, but timely insemination is important. Timely insemination is important for this condition. If delayed ovulation, that means with the time whenever we have to inseminate the cow before ovulation. Sometimes the massage of cervix and the clitoris after insemination may also be helpful in promoting ovulation. So these are the certain conditions where there will be treatment of the repeat bleeding. Now, with this one, that infertility, I want to conclude the infertility in dairy cows with the following points: that diagnosis of cause of infertility in animals, there should be proper investigation and evaluation is must. Evaluations are concerned with the health of the animal as well as the condition of the genital tract, the physiological functioning of the ovaries, and consecutive growth and development of the fertilized embryo. The treatment of infertility in cows varies with the causal factors. So these are the certain, that is conclusion of my, that is. But I have also, in the topic I have that future strategies. What should be the future strategies to have a, so one of the most important criteria for have a fertile cow, that there are a number of key areas for improving fertility management is handling of data. I shall be discussing this thing: genetic selection, including improved phenotypes or use in breeding programs; nutritional management, including transition cow management; control of infectious diseases; reproductive management, an automated system to improve reproductive management; ovulation, oestrus synchronization is another area where whereby we can go for the remedial measures for infertility, and we can have a good fertility of those animals. Rapid diagnostics of reproductive status and management of male fertility. So that is, everything is included here. This is the future strategies. So I will take another 5 to 10 minutes to just discuss this thing. Genetic strategies to improve reproduction. What does it? That means dairy genetic selection programs in dairy producing countries traditionally selected predominantly for milk yield, often at the expense of their dairy relevant traits, including fertility and health. So whatever in the field condition we are there, like that, yeah, this animal is giving maximum milk per lactation, so we need the progeny of that one. And scientists also, they are propagating that genetic material only. But in many cases, they are neglecting the other parameters, other relevant traits of the dairy animals, like the fertility and the health. Only the selection of the genetic material of dairy cows is based on milk production or the production level. But fertility and health status of the animal, or the health, uterine health of the animal, overall genetic health, overall genital health of the animal, it is maximum time it is compromised. So that's why the production is okay, the milk production is okay, but in subsequent lactation we are getting infertility problems in these cows. So that is one reason why there is need to go for selecting the dairy cows, not only on the basis of milk production, not only basis milk production, it should be including all the fertility and the health. The new tools and application to new phenotypes that may be used in dairy sector. So this is another, in university, that is University College Dublin, he has developed that they have developed a glycan markers for uterine health, to check the uterine health. Indeed, milk-based glycan markers have also been developed that can predominantly, predictively identify cows having retained placental membranes. So these are some newer concept is coming to check the uterine health, and wherever there is a possibility of retained placenta or not, that can be detected by this marker, glycan marker. And because of this, such biomarkers that are easily measured in milk would allow animal breeders to select for cows with a propensity for improved uterine health and therefore move towards cows that would have increased fertility. So with this one, we can go for a cow for selection of dairy cows with good in, increased fertility or with good fertility. Nutritional strategies to improve reproduction. That is another sector that is the most important factor, or that is the most important criteria that is we have to give much more important on these nutritional strategies to improve the reproduction. It is that said that early milk lactation that is associated with a very high capacity to mobilize body reserves during this period, that early lactation. But over mobilization of body reserves during the period of any that is negative energy balance is a key factor for disease susceptibility in modern dairy cows. Furthermore, in addition to post-calving energy balance, pre-calving loss in body condition also has significant consequences for metabolic status, milk composition, and subsequent health of the animal. So this includes, that is the improved reproduction we have to go for the, that is why nowadays, just after parturition, we should go for glucosenic diets being the advantage when offered in immediate postpartum period, while they should be avoided when cows are inseminated. So these glycosenic diets, they can be given just after parturition, but then this should be avoided when the animal are inseminated, when the animals are inseminated. Sometimes we should avoid the rations where it may lead to high peripheral urea, and it may be associated with lower pregnancy rates due to detrimental effects on the embryo. So these are the certain conditions where we have to take care of the nutrition. Another condition, that adding of fats, is another strategy that has been extensively tested to reduce impaired reproductive capacity of dairy cows. In this, a study was aimed to that a study said that aiming to minimize the negative energy balance by decreasing the milk fat synthesis, and hence limiting energy output via milk by supplementing the ration with exogenous fats, was not successful, since cows simply produce more milk when reducing the negative energy balance. So that's it is an disadvantage sometimes it is having. Then another condition, adding of extra vitamins and minerals to the diet has often been suggested as a golden bullet to reduce declines in cow fertility. Then the next is the controlling infectious diseases. That another condition that is we have to take, that is some of the infectious diseases. That means the uterine health should be very much good. So infectious diseases we should be able to control in the breed or in the animal, whatever we are selecting. So that is why we should go for a regular evaluation of the hard health status for pathogens which is known to compromise reproductive efficiency. And appropriate biosecurity plans, appropriate vaccination protocols may be required to prevent the disease. So this is another criteria where we can put much effort to do the things in a proper manner to avoid infertility in the dairy cows. High incidence of subclinical endometritis in high-yielding herds has been reported. Diagnosis of this impairment is based on intrauterine sampling for cytology is important. So that is why in a work by Pascottini et al. 1915, they have developed a instrument that is called cytotap that allows sampling early postpartum and during insemination and facilitates profiling of uterine cytology in repeat breeder cows. The generally accepted necessity to minimize the use of antibiotics in cows should be extended to treatment of uterine infection. So with this instrument, we can use the minimum antibiotic whether there is infection or not. If there is no infection, we should not use, because the, in this time the animal is in heat, we have seen that there may be mild infection, but in the subsequent there may not be. So that is why this instrument will be helpful for diagnosing the uterine health. Then use of precision livestock farming, that is another livestock farming, that is managerial efficiency. Stress detection, we have to go for stress detection, and properly and efficiently we have to go for the stress detection of the dairy in the dairy cows. Then stress detection, if we go for stress detection of stress for at least for 20 minutes for 5 times per day, then we can detect the animal in stress. Whatever the animal is stress, it is 90 to 95% animal we can detect, in comparison to, that is, for 30 minutes for 2 times, it is only 70% cows may be detected in stress. But 20 minutes observation 5 times a day will increase the efficiency of heat detection within the range of 90 to 95%. That means whatever the animals are coming into heat, almost all animals will be detected with this technique. Then sensors for stress detection is also another, it is there, that is pressure sensors, activity monitor, and endocrine profiling. We can go given. So this is what the sensor monitor. We can go pressure, that pressure monitor. We will keep some of the thing that may be this includes, scratch cards, color ampoules, vasectomized bowl fitted with a chin ball marker. So these are the some utensils, some that is appliances which can be used for stress detection. Activity monitor, if we go for the activity, that is like a pedometer. If we go for a pedometer, maybe give us the activity of the animal, that difference of the activity in normal times and difference in activity during the time of stress, that may be helpful for detecting the stress. Then endocrine profiling, this also a very good technique for measurement system to, and for endocrine profiling recently developed, that is to detect metabolites and progesterone concentration in milk. Detection of progesterone, we can go for that, whether the animal is in heat or not, we can detect it. The another technique for, if we do not go for the detection of stress, then we can go for stress synchronization and ovulation synchronization. It is okay that we have synchronized protocol. This is GnRH, then PGF-alpha, GnRH, and timed AI we have done. And after 16 days, if we go for endocrine profiling, we may get, yes, the animal is positive for pregnancy. That means it has shown certain change in blood plasma. But if on 16 day, if it becomes negative, you can go for, after 2 days, we can go for a PGF-alpha injection. Again, after 2 days, on day 20, we can go for GnRH injection, and timed AI after 121st for timed AI. This will help us. That means one cycle is not missed. Is not missed. That means the production criteria will be the same. With this technique, we lost due to, that is long waiting for the pregnancy diagnosis. Then it is pregnancy detection. There are some direct methods of pregnancy detection, which is rectal palpation and the ultrasonography. These are the direct method for pregnancy diagnosis. Then there are some indirect methods of pregnancy detection in dairy cows as early as possible. Then it will include the milk progesterone test and test for pregnancy associated glycoproteins in blood or in milk. So this will help us to avoid the days which are being wasted whenever the animal is not pregnant. So with this help, with the help of this technique, we can go for early pregnancy diagnosis. If not, then immediately we can take the remedial measures for that animal to get it pregnant. That is the, we have to go for the, that is for the male animal, we have to take care of the male animal. That means the semen, it should be very fertile and it should be okay. We have to take care of the male also in this side. Then usage and availability of the big data. Now we know that many researchers exploited randomized control trial to explore the complex relationship between production and reproduction in dairy cattle. So there are in whole all over the world so many researchers, they have exploited
Mm.
the complex relationship between the production and reproduction. But this data, if we do it scientifically and if we keep it for further use, then we can have a progeny testing, that dairy cow, which will be having a very good milk production capacity and as well as a uterine health and as a, having a good fertility. So with this data, we can go for the
Then information.
detection or the
Need like
that is what is called the identification of that particular animal or that particular trait for
largest করে
milk production as well as for fertility and the uterine health of the dairy cows. So this data, it is a very good tool for analysis and we should use it for getting the right animal in right time. So with this, the strategic, in this future strategy, the conclusion, I want to conclude the thing with the following few points, that development of new and novel fertility phenotypes that may be measurable in milk fertility and in terms of uterine health. Specific fertility genomic markers, we can have this one for identifying the dairy breeds. Earlier and rapid pregnancy detection, which may minimize the duration of wastage time, unproductive wastage time. Increased use of activity monitor, improved breeding protocols, we can have improved breeding protocols, automated inline sensors for relevant phenotypes that become more affordable for farmers, and capturing and mining multiple sources of big data available to the dairy farmers. So with this one, we can have a good dairy breeds or dairy animal, which will have maximum production with good fertility and a good uterine health. So this should facilitate improved performance, health and fertility of dairy cows in future. So with this, I conclude my lecture and I thank our Honorable Dean Sir of CBSC Khanapara, the Professor and Head of the Department of Animal Reproduction, Gynecology and Obstetrics, CBSC Khanapara, the organizers of this webinar, and other faculties of College of Veterinary Science, Khanapara, and all the listeners who have listened to me, though it is a little bit not up to the mark as compared to Kumaresan sir, but still I wanted to discuss some of the points and refresh the knowledge
Oh, yeah.
according to whatever it is there. So I thank all, and with this one, I once thank all the listeners. Thank you very much.